So you have macular degeneration. Well, first of all, what is macular degeneration? Macular degeneration is when the sensory vessels in the back of the eye, in the retina, degrade over time. Now, these cells are light sensitive, so they can break down just with age. But if you have family history of macular degeneration or have very light eyes, you are at higher risk. Also, another risk factor is smoking and prolonged UV exposure. Living in Florida is obviously going to give us more sun exposure than somebody that lives up north. So wear sunglasses when you're outside, even if it's just for 5 minutes. It'll just add up over time. So I recommend to all my patients, wear sunglasses anytime you're outdoors, even on overcast days. It'll protect your retina and the breakdown of those cells. There's two types of macular degeneration. There's wet and dry. Wet macular degeneration is treated with injections. The injections, although they sound very scary, can save your vision. My father actually has wet macular degeneration. He gets injections every 6 weeks. Every 6 weeks he goes in, gets an injection, and what that does, it brings the vessel growth down inside the eye, which is what's happening in macular degeneration. The cells start dying and new vessels grow in to replace them, and those vessels kill the retina. So what we want is those vessels to go away. In the past, they used to do laser treatment to treat parts of the retina with macular degeneration, but now we've found anti-VEGF medications which we can use to help us with this case. Now, there's also dry macular degeneration. Dry macular degeneration, unfortunately, there's no treatment for this. In dry macular degeneration, really, we just need to monitor it, and we might recommend low vision devices for those situations. In the early stages of macular degeneration, you might not even know you have it. So it's very important to come in for an annual checkup because we're able to diagnose macular degeneration years before it's actually visible on the retina itself. So make sure to get checked out so we can manage you appropriately.